Amputation and Prosthesis Care Presentation by Craig Warren. Welcome to my presentation on amputation and prosthesis care. This presentation will cover a very brief explanation of what amputation is, the pathophysiology of amputation, which covers the functional changes associated with amputation, how amputation can affect the lives of those who live with it, finishing with several examples of how a nurse assistant can apply his/her knowledge in a clinical or practice situation. I hope you enjoy my presentation. What is amputation? Amputation is removal of a limb by trauma, medical illness, or surgery. There are roughly 2 million amputees in the United States, with an additional 180,000 lower extremity amputations performed every year in the United States. In the US, 56% of amputations occur due to complications of the vascular system, blood vessels, especially from diabetes. The remainder of amputations occur due to accidental injury, like car accidents, and cancer. Pathophysiology of amputation. Amputation brings a number of functional changes associated with the loss of a body part through amputation. I have listed some of the functional changes here for you to view. Phantom sensation. This is the feeling that a person may have that the amputated body part is still there, usually through itching, tingling, and warmth sensations. Phantom limb pain. This is the feeling of pain in the area that has had the amputation. There can be several reasons for this feeling, one of which is damaged nerve endings. Stump pain. This pain felt in the area of amputation on the part of the limb that remains. All of the functional changes mentioned here are real and should be treated as such. As a CNA, you should report any changes the resident is experiencing to a nurse. Do not ignore them. How amputation affects life. Amputation affects life in a number of ways. For example, how you as the amputee deal with mobility. The one simple task of getting from point A to point B now needs a lot more thought applied to the process. It can also affect your intimacy with your partner, which can be very upsetting. Like it or not, it can also have an effect on your work or career. Associates staring at you, accommodations made for you that just draw even more attention to you, sometimes very negative attention. Amputation can affect your life in many ways, some positive, some negative. What should a nurse aide do in a clinical practice situation? Application of special compression bandages and/or stump shrinkers. Apply special compression bandages and/or stump shrinkers as ordered to help with swelling. Bandages should not be applied too tightly and should not cause pain. Stump bandages may be changed many times a day, so when they are removed, inspect skin carefully. Special positioning, including stump elevation. For amputees, special positioning to prevent pressure ulcers is usually necessary. The doctor may order stump elevation post-op, which can help reduce swelling. As a CNA, be sure to carefully follow orders for bed elevation and positioning. Be supportive during adjustment process. A resident may have difficulty adjusting physically and emotionally to a new prosthesis. Because of this, residents may encounter feelings of depression, sadness, anger, frustration, or a combination of these feelings. As a CNA, be supportive during the adjustment process. Encourage activity. When activity is ordered by the doctor or nurse, try to encourage the resident to take part in the activity. Activity, if ordered, may aid in the speedy recovery of the resident. 30 minutes prior to any ordered activity as a CNA, be sure to check with the resident and your nurse to see if pain medication is needed. Final thought. The greatest disability of all is a bad attitude. As a CNA, and as a member of the human race, treat others as you would like them to treat you, with dignity and respect. The Amputee Coalition is the nation's leading organization on limb loss dedicated to enhancing the quality of life for amputees and their families, improving patient care and preventing limb loss. If you would like to make a donation, go to amputee-coalition.org. Thank you. I hope you enjoyed this presentation.